Namaskar. Today we are going to talk about the trio of flatulence, which has been given by Dr. Nash. He mentions three important remedies under it, obviously. So those remedies are China, which is also called as Cinchona Officinalis, Carboveg, and Lycopodium. So we'll start with China today, and then subsequently we are also going to study Carboveg and Lycopodium in the further videos. Okay, so let's start with China, which is Cinchona officinalis. So over here we see that Dr. Nash talks about the weakness and debility of this remedy in the very start. So the patient is very weak, very debilitated, and hence Cinchona in the old school is also used for the same purpose, and in homeopathy also. But when we talk about its use in the old school, it is used as a tonic on general principles. Anybody who is weak or debilitated may get Cinchona, but in homeopathy we prescribe it only on the basis of symptom similarity. So now Hahnemann expresses it in the following words. As you know, Cinchona was the first remedy that actually Hahnemann had discovered to have potential after potentization, or potential to cure after potentization. He had discovered the whole symptom similarity concept through this Cinchona bark experiment, and that is how we found out about homeopathy. So this is a very special remedy. China is a very special remedy. Let's see what Hahnemann himself had said about it. So he expresses it in this way, saying that debility and other complaints. Okay, so debility or any complaint that this patient has after loss of blood. So loss of blood or other fluids. So now this is an ailments from. That means this is an ailments from. Particularly by nursing or salivation, bleeding, cupping, etc. or white seminal emissions, etc. So meaning in any way, if you're losing your vital fluids or your fluids, then that is going to lead to debility or other complaints in China. So it can be by nursing, by lactating, by salivation. So even if your your salivation is increased, okay, or if you're bleeding a lot, or cupping has been practiced, if there's a lot of seminal emissions that is happening, then any type of loss of fluids will give this patient debility or any kind of complaints. That will be the ailments from for this patient. Now, Dr. Nash says that I would add profuse suppuration and long continued diarrhea also. So, a loss of fluids because of long continued diarrhea or because of a lot of suppuration, a lot of pus formation does actually also come under the ailments from for Cinchona according to Dr. Nash. So now we understood that the ailments from for this remedy is loss of fluid or depletion. So what does this loss of fluid or depletion does? Okay, so there are two things that can happen. First of all, this loss of fluid can be very sudden, very fast, very quick. It might be very sudden, or it might be slow and a continued long drain. Like we just saw, Dr. Nash had said that long continued diarrhea can be an ailments from for Cinchona. So that will come under this section. And sudden, the examples are hemorrhage from the womb, from the uterus, from the lungs, from the bowels, or from the nose. If there's a lot of hemorrhage suddenly that takes place, then it can be like this. So there are these two ways. It can be in a sudden pace, or it can be slow and gradual. So what happens is the symptoms also follow in the same manner. So if it is a sudden loss of fluid, then the patient might faint, there will be loss of sight, ringing in the ears, etc. So these kind of symptoms will prevail. And if there's a long continued drain, then you can have any kind of indications which are mentioned in materia medica of Cinchona, like pale sallow face, sunken eyes. There are sunken eyes. They have this pale face, the dark rings around the eyes. Okay, there's throbbing headaches that they will get. There will be night sweats, and he also sweats very easily on least motion or labor. So these kinds of symptoms will follow if the loss of fluid or depletion is very slow. Okay, so in this way, Dr. Nash describes the loss of fluids. Then he moves on to a very important sphere of action of this remedy, which is GIT. So we are talking about the trio of flatulence, and the trio of flatulence has to do with the GIT only, right? So GIT is a sphere of action, very important sphere of action of our remedy, Cinchona officinalis. But before mentioning about the GIT, he talks about the loss of fluid, because that itself shows the importance of this ailments from for Cinchona. So whenever Cinchona it comes to your mind, whenever you read about Cinchona anywhere, the first thing that you need to remember is loss of fluids. Okay, so now let's move on to the important sphere of action, which is GIT. So in GIT, you see there is a lot of there is a loss of appetite. Sorry, so there is a loss of appetite, but there is also canine hunger. Both are there, but if you see that if you see, Dr. Nash says that canine hunger is more characteristic. So even if both can be there in patients, but canine hunger is mostly to be found. Okay, now there is slow digestion, and yet there is hunger at mealtime. So see, even if the digestion is slow, so normally if there is slow digestion, the patient must feel full, right, even after a long time of eating, but they do not feel so, and they actually feel hungry. So the patient says, sometimes it seems as if the food all turned to gas. So he feels that whatever I'm eating is just turning out into gas, okay? And they feel so full and oppressed, they can hardly breathe and still will feel hungry at mealtime. So now it's not that they are not feeling full. They are feeling so full, in fact, that they're oppressed because of that. They can hardly breathe because of that, and even after that they're still feeling hungry at mealtime. So if you get this kind of situation in your patients, you can obviously think of China from now onwards. Okay, so then we move on to the flatulence part of it. So now he says that China is a great flatulent remedy, the choice often remaining between carbovage and lycopodium, and that is the reason that he mentions these three as a trio of flatulence. So he also does mention a very clear-cut difference between carbovage, lycopodium, and China. Their indications about flatulence, but that he mentions under lycopodium, and we will also discuss it when we will be discussing about lycopodium. The difference between the flatulence of these three remedies and how we can differentiate the patient, the symptoms of the patient, and to choose to prescribe carbovage or lyco or China. Okay, but yeah, they are very similar and we might get confused. So now H.N. Guernsey expresses it about right in these words. So how does he talk? So Dr. Nash feels that H.N. Guernsey expresses it in the best way, so he gives us his explanation so that we can understand better. So he says that uncomfortable distension of the abdomen with a wish to belch up. So they have this uncomfortable distension of the abdomen. The abdomen is so distended, and that because of that they just want to belch up. They want to have an eructation. They just want to get the gas out. But or no, this might be there, or there might be a sensation as if the abdomen were packed full, not in the least relieved by eructation. So even if they're feeling this fullness in the abdomen, it might not even be relieved by eructation. So they do want to have eructation, but even after having it, they're not feeling better. It is not helping them. That can also be the situation. So this is about the flatulence. Now what does he say? The next thing is about the diarrhea. In diarrhea, he says that these patients, China, has a tendency to diarrhea. Okay, and that does show us that their process of digestion is seriously impaired. Just a few minutes ago, we also saw that we also read that there is slow digestion in these patients, right? There's slow digestion and yet hunger at the mealtime. Okay, so we know that there is some problem with the process of digestion. Now this impairment that happens in the process of digestion is especially from eating fruits. So fruits are now another ailments for these patients. So whenever they have fruits, their process of digestion will get impaired, and that might give them the tendency to die. That might give them diarrhea. Okay. Now, the stools are watery, yellow, brownish, or light colored and undigested. So, the slow digestion or the digestion impairment is so much that even undigested food might come out through the stools just like that. Now, he says that they are painless, not generally found under other remedies. So, not all remedies, in fact, not majority of remedies do have painless diarrhea. But China has painless diarrhea, and that is what he highlights. So this is what Dr. Nash says, not generally found under other remedies. And it is accompanied with large discharge of flatulence. So along with the stools, there is a lot of gas that is passed, like calcaria phos. Okay, now what does he say? He says that this condition of abdomen with attending diarrhea is often found in children. And the child is weak, he is pale, Now, weakness is going to be there. So, the first point that we talked about in China was debility, right? So, the child is going to be weak if it's China, okay? The child is pale with dark rings around the eyes, right? And here, China is the remedy, not Sina on the theory of worms. And it is astonishing what improvement follows in a short time. So, every time a child is getting diarrhea, as he's having some abdominal symptoms, you do not need to think of worms of Sina. Okay, the remedy might be China as well if you have the symptoms that match with the remedy China, right? And and they do match many a times. That is what he wants to say, that you have to think about it, and it will help. Astonishing improvement follows in a short time. Okay. Now, next he talks about the action of China on liver, and he says that China is one of the best remedies for chronic liver troubles. So, sphere of action of China. Whenever you think about the sphere of action of China, you have to think about liver. Okay, and what was the ailments from that you need to remember? It was loss of fluids, and it was fruits giving them diarrhea. Okay, and liver is a sphere of action. Chronic liver troubles is something that come under the action of China. So there is pain in right hypochondria. The liver is enlarged, and since it is enlarged, it is felt below the ribs and is sensitive to touch. So it is tender, it is hard. The skin and the sclera are yellow, and urine is also dark colored. So all the symptoms that we usually commonly see in any liver disease are present. Along with that, there are abdominal symptoms of China. Okay, the distension of China, the hunger, so whatever. So all those things will also be present, and it is also good for splenic diseases. Okay, so now whenever this picture along the typical China symptoms are present, and along with that you have a disease, liver disease, you have to think of China. So the next he comes to his hemorrhages. So this is the end of GIT. So whatever he has to talk about. So what did we actually see? He talked first about the hunger of this remedy, which was, he also has a loss of appetite, but he can also have canine hunger. There's slow digestion and also hunger at the meal time. So even if he's feeling very full, he's feeling very full, very oppressed, he's not even able to breathe because of that fullness, then also he just feels hungry at mealtime. That was the first point. Then we saw that this remedy is a great glycerine remedy, along with what? Carboveg and Lyco, which is the trio that we're going to discuss now. We are discussing right now. Now, Dr. H.N. Gernsney has said a few things, that there's a lot of distension. They want to have an irritation. They feel that maybe if I belch up, I'll feel better. But even after belching, they are not offered any relief. Okay, and then we talked about diarrhea, especially the diarrhea was from fruits. The stools were painless. Okay, and there were undigested stools also, with large flatus also coming out with the stools, and it is also seen in children. And you need not think of Sina always, but you might also need to add and start thinking about China for children. Okay, then we talked about liver. Now we're moving on to the next point, which is about hemorrhages. So this remedy also, and even Carboveg, has a lot of hemorrhages. Okay, and when we'll talk about Carboveg in the next video, we will discuss that also. So now let's see, bleeding may come from any or every outlet or orifice of the body. So see, the hemorrhages so much. So there's so much tendency to hemorrhage that it may come on from any or every outlet or orifice of the body. So the other remedies that also have this kind of bleeding is Carboveg, Ferrum, Crotalus horridus, phosphorus, sulfuric acid, which also claim attention in these kind of situations. Okay, Crotalus horridus is a snake remedy. So snake remedies are usually have this hemorrhagic tendency. Phosphorus is famously known to have hemorrhagic tendency. Carboveg also, now, and we will discuss about that. Ferrum and sulfuric acid also claim this attention. Now, blood is dark and clotted, so blood is not bright red. Okay, even in Carboveg the blood is very dark, and now we've seen that even in China the blood is dark. Okay, there are other remedies which have bright red bleeding, like millefolium has, like nitric acid has, but here there is dark clotted bleeding. And there's ringing in ears, loss of sight, general coldness. So there's general coldness also, and coldness is also something that we find in Carboveg, and it is more characteristically present in Carboveg than China. But there's also there's this coldness in both the remedies. Okay, the stages might be different. So there's characteristic coldness in China also, and sometimes convulsions. And after discussing about the general loss of fluid related symptoms, weakness related, and GIT and its action on liver, on the hemorrhage and on the tendency to hemorrhage and all. He finally comes to two important points about this remedy. First one being periodicity, and second one being the excessive sensitiveness of this remedy, which we're going to talk about. So first, let's see what does he mention under periodicity. So you might already know that China is a great has a great kind of periodicity. So symptoms actually come at a regular interval of time. So now, in old school, this remedy, Cinchona, not in the potentized form, but as quinine, was given for malarial fevers or any kind of malarial diseases. Now, he says that how it's different with homeopathy. In homeopathy, it is a great remedy when indicated by the symptoms for periodical affections. Okay, so for periodical affections. So now this can be of malarial origin or may not be of malarial origin, but the only thing is that it has to be periodical. Okay. Then it is also true for eupatorium, perf, ipecac, natrimur, arsenic album, and a host of other remedies. So this periodicity can also be seen in these remedies. Okay. Now, affections that do not come under the head of malarial strictly, if they are worse every other day, should call attention to Cinchona. So any kind of symptom which might or might not be even related to malaria, but if it comes periodically, should call your attention to Cinchona. This is what Dr. Nash tells us. Over here, he mentions a bad case of inflammatory rheumatism, and he says that it was treated by an eclectic physician with local application. So, local application was given, because of which the root of the disease did not get away, and the disease was not cured completely, and the disease was actually suppressed with this application, and the disease got driven to the heart. So earlier it was rheumatism, but since it was suppressed, it went on to affect the heart, which Dr. Nash quickly relieved with China. Now China, why was China chosen? But so China was chosen due to every other day, that is periodic aggravation of symptoms. Of course, there were other indications for the remedy, but this was the key that helped to unlock the case. So periodicity is such an important characteristic of this remedy that this periodicity was something that brought Dr. Nash's attention to China as a remedy for this case. It was the key that helped to unlock the case. Okay, so that's about the periodicity. He also mentions a very important point and tells us about this thing that those who depend on China or its alkaloid as a general cure-all for intermittents, meaning those who think that any kind of intermittent disease, intermittent fever, periodical fever is there, and you give China and it will cure it, okay, will meet with disappointment. So these people will meet with disappointment all along the way. Because while it may have the power to suppress the paroxysms in many cases, it has the power to cure in comparatively few. So if you give it in any kind of intermittent disease or intermittent fever, you think that yeah, China has this kind of periodicity, let's give China because there is periodicity, then you will meet with disappointment, because yeah, China might suppress that paroxysm for that time being, but it might not cure that case. It will cure only comparatively few, because only few will have exact symptom similarity match, right? Exact picture will match with China, not all of them. I have seen a case suppressed time and again with it. Okay, so China was given because there was periodicity, and it returned as often for over a year and a half that I cured with a single prescription of eupatorium perf. So now this patient had this complaints which was periodical, and this doctor gave him China. So he felt better for some time. Again he came back with the complaint. Again he gave China. So this was happening, but Dr. Nash cured it with a single prescription of eupatorium perf, and so he has also done with natrimur and arsenic album. So he wants to tell us that do not think that just because of periodicity the remedy is China. You have to think of or see the other symptoms also. The whole totality of symptoms should match. The whole picture should match. Next point that he talks about, the characteristic point that he talks about, is the excessive sensitiveness of the nervous system. So here it tells us that the special senses seem to be too acute in this remedy. The mind is unpleasantly affected. And nothing is more characteristic of this remedy than, so see, Dr. Nash is saying that nothing is more characteristic of this remedy than its extreme sensitiveness to touch. Also seen in asafoetida, heparsilf, and lachesis. So extreme sensitiveness to touch is there, okay? This symptom is something that we do not usually think of about China, but Dr. Nash mentions it as a very, very characteristic symptom. So he says that there is extreme sensitiveness to touch, and it is also seen in asafoetida, hepar and lachesis. So let's see what he talks about this symptom, okay? So further he also tells us that it affects the skin all over the body. So even the skin, even the hair feels sore. So much is the sensitiveness that even the hair feels sore, so says the patient, because moving the hair hurts the sensitive scalp. See, even moving the hair will hurt the sensitive scalp. And in addition to this, one peculiar thing is that while the lightest touch will increase to an extreme degree, the pains of the disease depart, hard pressure relieves. So in China, hard pressure relieves, even if they are so sensitive that a lightest touch will cause them intense pain. Okay, so this sensitiveness is so extreme that a current of air blowing on the part will cause great pain and suffering, even a current of air blowing on the part. There is also plumbum and capsicum which have this kind of sensitivity. Plumbum has excessive hyperesthesia, especially after diphtheria. So post diphtheric paralysis is there, and in that paralysis they have this excessive hyperesthesia. Plumbum and capsicum also has this kind of sensitiveness. So now just let's quickly revise what we have talked. This is all that Dr. Nash says about this remedy. Let's revise. So let's revise this special remedy, the first remedy to have been proved by Dr. Hahnemann. So we started talking about it with the word and a very characteristic symptom of this remedy, which is weakness or debility. And this weakness or debility, as Dr. Hahnemann had said, is due to loss of fluids. And this loss of fluids which actually means it can be, it can be blood, or that is hemorrhages that is happening, because of which you have loss of fluids, or which because of which symptoms are actually getting produced. It might be even salivation, excessive salivation. It might be due to nursing, by which he means lactating, which might be due to seminal emissions. So any kind of fluid loss giving you debility, weakness, or any other complaint, you have to think of China. Then Dr. Nash added to this long continued diarrhea, and also added profuse suppuration, lot of pus formation. Okay, and the pus is also actually, through pus your fluids are also getting you're also losing your fluids. Then we talked about this loss of fluids or depletion again, which may be sudden or it may be slow, like in long continued diarrhea. Okay, and if it's very sudden, it can be from like hemorrhage from your uterus, from lungs, from bowels, etc. It might give you you might faint actually because of that. You might lose your sight because of that, and ringing in the ears can also be there as a symptom. If it's slow, then many indications may be there. So whenever we read for Cinchona and you will find many symptoms which will be there. So some are there like pale, sallow face, there is this kind of rings around your eyes, dark rings. So this is a cartoon, so it's obviously not like this in your patient, so you have to go and search on how you'll see it clinically. So there's this dark rings around eyes, throbbing headaches, night sweats, and he sweats easily on least motion or labor. Okay, this was all that we talked about in the very start about the weakness, about the loss of fluids. Okay, next we moved on to talk about the GIT symptoms, which are very, very important, since this remedy is actually a remedy from the trio of flatulence, which also has carbo-veg and lyco, right? So GIT is obviously very important. So let's see what he tells us in GIT. In GIT, the first thing that we talked about was hunger. So in this remedy, you see that there can be loss of appetite, so no appetite, loss of appetite, or there can be even increased appetite. There can be canine hunger. Okay, and there's even if there is slow digestion, they are hungry at mealtime. Right? So patients actually feel so full and so oppressed. So their abdomen is distended. They're feeling so full oppressed that they can't even breathe. But even after that, they feel hungry at mealtime. That is a symptom of China. Next, we talk about the flatulence. So there's a lot of flatulence, and as I've told you, we'll talk about the differentiation of flatulence in these remedies when we'll be talking about LICO, because that's given in under LICO by Dr. Nash. Then he tells us that there's a lot of distension in these people. Okay, there's a lot of distension of abdomen, and they want to have eructations, but even after belching up, they do not feel better. Then we talked about the diarrhea. So these people have a tendency to diarrhea, especially from fruits, and the stools remain undigested since there is a lot of problem in the process of digestion. So the stools remain undigested, and the important thing is that there is painless diarrhea, which is characteristic because it is not found in many remedies, like Dr. Nash tells us. And with the stools, there is also flatulence, like we see in Calcarea fos. So we've already discussed this remedy from Dr. Nash's Materia Medica, right? Calcarea fos. So he says now when this condition, so when the symptoms of China are present in a child who comes to you for diarrhea, you need not only think of Sina when patient comes to you with, worms related symptoms. You also have to think of China if these symptoms are there. That is what he tries to tell us. Then we talk about the action of this remedy on liver. So it has a very marked action on liver, for especially chronic liver diseases, chronic liver troubles. So all the common liver related symptoms will be present, like the urine will be dark color, the skin and sclera are yellow, the liver is enlarged, sensitive to touch. Yeah. There's pain in the right hypochondria, and plus along with that there will be abdominal symptoms which are related to China, and it is also good for splenic disorders. So even spleen is a sphere of action for our remedy China. Then we talked about the hemorrhagic part of this remedy. So this remedy also has a lot of hemorrhages from all orifices of the body. There can be hemorrhages from any or every outlet and orifice. So we also talked about other remedies that Dr. Nash tells us who have this hemorrhagic tendency, like carboveg, ferrum, crotalus solidus, phosphorus, sulfuric acid. Okay, then the blood here is actually dark and clotted, right? And along with bleeding, you see that they also have ringing in ears, they have this general coldness, which is a very important symptom. Yeah, they have this loss of sight, as we have already discussed, ringing in ears, as we have already discussed, and also may have convulsions. Okay. Then we talked about two very, very important points that this remedy has. One was periodicity, and second one was sensitiveness, especially to touch, right? So we saw in periodicity that whenever you have periodical affections, it might be of malarial origin or might not be, but you have to think of China. And there are also other remedies for periodicity, like eupatorium perf, like ipecac, like natrium, like arsenic album. Okay, he also tells us about a bad case of inflammatory rheumatism over here, and in which he chose China on the basis of periodic aggravation of symptoms. And then he tells us that you should not give any and every case which has periodicity China as a remedy, because it might not help, because homeopathy works only if there is symptom similarity matches. Not only just one symptom, but the totality of symptoms should match. Then we talked about the excessive sensitiveness, which is especially, he says that nothing is more characteristic of this remedy. Nothing is more. So understand the gravity of what he is speaking. Okay? He says that nothing is more characteristic of this remedy than its extreme sensitiveness to touch, which is also found in asafoetida, in heparsulf, and in lachesis. Okay, he says that this sensitiveness affects the skin all over the body. Even the hair feels sore, and moving the hair, is hurting the sensitive scalp. Lightest touch will increase this patient pain to a lot of degree, but hard pressure ameliorates. So this is very weird, but it is there. So it is truth nevertheless. Okay, so hard pressure is ameliorating even if the pains are extreme. When lightest touches aggravates actually. So the sensitiveness is so extreme that a current of air blowing on the part will cause great pain and suffering. Now there's also plumbum that has this kind of sensitiveness. There's also capsicum that has this kind of sensitiveness. Plumbum especially in post-diphtheric paralysis. So this is all that we talked about this remedy, Cinchona Officinalis. That Dr. Nash talks about this remedy. Okay, this is nothing from my side at all. Whatever I have written, whatever are the notes that are being made, are all taken from Dr. Nash's Materia Medica, and it's mentioned so in the heading of the video also. It's all his explanation, and it's nothing from my side. So this is what Dr. Nash tells us about this remedy. He very beautifully he has talked about some characteristics of this remedy as well, and some sphere of action of this remedy, and the very important loss of fluids and weakness part of this remedy also. Okay, so let's meet in the next video where we will be talking about this trio of flatulence, and we will cover all these three remedies now.